Okay, I guess we can start now. First of all, thank you so much for joining us on a Wednesday evening for our talk to learn about Parkinson's. Just a gentle reminder that this session will be recorded and we'll be keeping all participants' audio off. Along the way, should you have any questions, just click on the chat icon and just type in the questions. Maybe Tasneem will be able to address them at the end of the talk. So just a quick introduction about the golden concepts. We curate a range of quality elder care products to enable aging well. So we largely focus on promoting mobility and maintaining independence in our golden years. Besides doing products, we also create events such as this, and we also curate content to educate both caregivers and seniors about key matters relating to aging. Because we believe that education is key to enable us to age well. So we've started the Golden Concepts Virtual Talk series on aging well earlier this year. And so far we've done quite a few topics, including exercise, maintaining mobility, and mental wellness. And so we are very happy that today we'll be covering quite another very important topic about Parkinson's. And we hope that through these events, we kind of form a small little community that we're able to learn together. And hopefully you have other people that you want to invite as well. Just feel free to share the event link. So today we have very honored to have Tasneem Basrai from Physio Helps, who will be giving the talk today on about Parkinson's. And Tasneem is an accomplished physiotherapist who has been in the profession for over 28 years. Her wealth of experience at Tan Tock Seng Hospital and in the community sector has earned her recognition and respect from various medical professionals as well as patients under her charge. So Tasneem is the founder of Physio Helps, and she currently focuses on providing holistic rehabilitation care for patients in their own homes. So Tasneem, I'll hand it over to you.
Hi everyone, a very warm welcome today evening. All right, thank you for the kind introduction. All right, so we can start. Let's start on. We're going to talk about, as Vanessa introduced, we're going to talk about Parkinson's and what Parkinson's is all about. And in hopefully at the end of the session, we're going to share. Let me share my screen here. Okay, so we're going to talk about Parkinson's and a little bit awareness of what Parkinson's disease is all about. And since all of you all who have participated, who are keen to understand more about this, so I'm sure you all have heard of the word at least of what Parkinson's is. Is that the word Parkinson's disease? So definitely you all know that this is something that is prevalent, that is common, that is heard of. And it's also getting more common now in Singapore as well. So yeah, okay, let's talk what this is all about. And through this presentation today, this is what we shall be touching on. What is Parkinson's disease? How does it happen? Who does it happen to? Why does it happen? What are the signs of Parkinson's disease? How do you diagnose that? How do we manage it? And can we prevent it? Yeah, so let's hope we can cover these things, and feel free to type in the questions, and then I'll see if I can help to answer them. All right, so what is Parkinson's? Parkinson's basically is a chronic, let me shorten my screen. Yeah, it's a chronic disease of a part of the brain. Okay, it's a small, very small part of the brain due to which Parkinson's happens. And it is named after a doctor who first described it in 1817. So there's this doctor in 1817, his name was Parkinson, and he saw a few people who had these kind of symptoms. So he thought that, he wanted to know more about it. He wanted to He described a little bit about what he had seen in these patients. Of course, at that time they did not have the technology, but even then, in spite of everything, he managed to bring out word, and it create an interest in the medical community at that time that there is something, a disorder that happens with the signs and symptoms that I'm going to talk about. And did you know that it's the second most common neurodegenerative disease in the world after Alzheimer's? So a lot of us would have heard what Alzheimer's is all about, and Parkinson's is the second most common disease. It's also a neurodegenerative disease. So I'll touch on what that means, okay? What does it happen? What happens in Parkinson's? It mainly affects the way the brain sends a signal to our muscles to move. So as in Parkinson's, some of the Parkinson's patients, there's difficulty in movement. So the signals that are sent by the brain to our muscles to move is affected, and this affects our body movement. The disease is slow and progressive. As it says here, it is a neurodegenerative disease. So it's not something that happens suddenly like stroke, but this is something that happens progressively. How does it happen? So this is a little bit scientific. So but it's important to know how does Parkinson's actually happen? It's a very small part of the brain called the substantia nigra is the one that is affected. As the name suggests, nigra, so it's actually a black color covering at the basal ganglia, which is a small part of the brain, which is at the bottommost part of the brain. And there's this, it's on both sides of the brain at the most basal part over here. So a black color covering that is made of the neurons that transmit the signals for the muscles to move. Okay, the cells in this part of the brain, it produces this thing called dopamine, which is a neurotransmitter. It's a signal. It's a neurotransmitter, means like a signal, like a Wi-Fi signal. The dopamine transmits the signal from our brain to the different other neurons, and then to our spinal cord, and then which goes on to our muscles, and then it commands it to move. So all this happens in milliseconds, right? So in Parkinson's, what happens? That the cells in this part of the brain gradually die. So because the cells die, there's no dopamine that is produced. And because there's no dopamine produced, transmission is reduced. The muscles do not get a signal that they have to move. And so there's difficulty in movement, which results in stiffness. Okay. So who does Parkinson's mainly happen to? It happens to people over 50 years of age. It can happen to younger people as well, but is less common, mainly to people over 50 years of age. It happens to both men and women, although it's slightly more common in men. Genetics and heredity plays a role in it. So if a close relative like your dad or your mom or your grandpa has it, then you have to watch out for it. Yeah, it's not necessary that you'll get it, but you have to watch out for it. And definitely it's not contagious. Yeah. So Singapore statistics, there are about 7,000 to 8,000 people with Parkinson's and related conditions in Singapore at this juncture, which is quite a bit. Why does Parkinson's happen? No one knows. So even now, even though it was found in 1817, it was discovered by this Sir Parkinson in 1817, and it's been 2 centuries, but it's still not known clearly in terms of why does it happen. So it's idiopathic, no known cause yet, no definite known cause, no major risk factors. Of course, there is lots of things that people still guess, and things that maybe it is environmental, due to certain pesticides or herbicides that are used. And these are from studies from rural countries where they have found out that certain pesticides that are used on plants, or there are certain herbicides which are used to kill off the weeds. Prolonged exposure to it may cause Parkinson's. Maybe genetic. That's also again not 100% sure. Maybe previous head trauma. And all of us know the famous Muhammad Ali, who has had Parkinson's, who was a Parkinson's patient, and his was because of constant exposure to boxing, constant exposure to head trauma, and so he had it as well. Occurs to so maybe, again, this is all a maybe, it occurs to 300 in 100,000 people, right? So it's only 0.3% of people in the world that get it. Approximately 15% experience symptoms when under 15 years old. So when they are under 50 years old. So 15% of these 300, they start experiencing the symptoms when they are under 50 years old. Sometimes the symptoms are mild, so you may not really feel that it's Parkinson's. Sometimes you may not really know that this is, what this is all about. But they gradually, the symptoms get worse as you grow older. Everyone okay with that? Okay. Oops, what happened? My screen. All right. So what are the signs and symptoms? Did I miss anything? Yeah. Why does it happen? We did. So what are the signs and symptoms? How do you know that this is Parkinson's? Of course, not everyone tremors has Parkinson's, right? So, but one of the signs and symptoms of Parkinson's is tremors. So tremors mainly affects the fingers, thumbs, hands, and arms. We'll see some videos about it later. So one of it is tremors, which is the most common symptom of Parkinson. Most commonly, you will see the people with Parkinson's having tremors, pill rolling tremors, or the fingers are trembling. And these are most noticeable on rest. So as compared to other neurological conditions where the tremors will happen because you want to reach out for something. When you want to reach out for something, then your hand starts to tremor. Whereas for Parkinson's, when your hand is resting on a table or something, then your hand starts to tremor. So when you want to reach out for a spoon, reach out for a pen or something, then the hand doesn't tremor as much. So this is the most distinctive feature of Parkinson's, where the tremors occur at rest. Okay, of course, it does not occur to everyone. Not everyone who has Parkinson's has tremors. Okay, it can occur in other parts of the body, like jaw, tongue, head. Sometimes the head also, there's this movement that happens all the time. And this characteristic of Parkinson's is that when you're anxious or emotional, then the tremors become worse. Yeah, so this is something that happens in a lot of Parkinson's patients. That's commonly seen. Am I okay? Am I too fast? All right. So I'm going to show a video of tremors, the classic pill rolling tremors, these are called.
We are showing you the pill rolling tremor in the Parkinson'S patient. You can see clearly.
So what happens is you feel like they're rolling a pill.
This is basically the tremor, and you can see in between the pill rolling is also there.
So this video is going to show you a jaw tremor of the jaw. And all this happens at rest. So you saw that the tremors, yeah. So these when the patient is rested, when he's sitting down or not really doing anything, that's when the tremors happen. And even the jaw tremors are something that's quite commonly seen, but jaw tremors are usually in the advanced stage of Parkinson, not at the beginning, preliminary stage. Okay, what are the other signs and symptoms? Right. So we spoke about tremors. We spoke about tremors, yeah, which is the most noticeable on resting, and it becomes worse and when you're anxious or emotional. The other signs and symptoms which are very common in Parkinson's is stiffness, slowness of movement. So slowness of movement is something that, again, for any one of us who has seen a Parkinson's patient before or who has dealt with someone who has Parkinson's before, you would notice that he's very slow in doing things. You want to get up from a chair, you want to get out of bed, you want to cross a curb. Your movement becomes very slow. You want to reach out for something. Your movement is very slow. You're not able to do it fast enough you're not able to fast enough grab for something. So there's a slowness of movement which is very characteristic, and there's stiffness in the muscles. So your muscle seems very stiff and tight. You can't just relax and go and reach out for something. It's very tight. You have difficulty in walking. Again, this happens at a later stage. And this, again, difficulty in turning, especially in narrow spaces. Again, this is very, very common seen in Parkinson's. And again, this happens at a later stage. Why I'm talking about stages, because Parkinson's classically is divided into, has 5 stages. Not everybody goes through the 5 stages. So, stage 1 to stage 5. Stage 5 is the worst. Stage 5 is the worst affected. Stage 1 is where the symptoms are very mild. Somebody from stage 1 can jump onto stage 4. Somebody from stage 2 can jump onto stage 5. But you can't regress. So from stage 2, you can't go on to stage 1 because it's a progressive disease. So if from stage 1, you go on to stage 3 or stage 2, or you go on to stage 1, stage 2, stage 3, stage 4, stage 5, or you can go on to from stage 1, you can go on to stage 4. But you can't go even with treatment, you can't from stage 4 go on to stage 2. You can't do that because it's progressive. You can be maintained at one stage, and it may take very long for you to go on to the next stage. That can happen with treatment, with therapy, with management, but you can't go back to stage 1. Yeah, so that's something we need to understand. It's a progressive neurodegenerative disease. So we were talking about difficulty in turning, especially in narrow spaces. And of course, there's balance that is impaired as well. So that's when a lot of Parkinson's patients fall because they can't turn in a narrow space, and the balance gets affected, and then falls happen, and then lots of other complications happen as well. Other progressive signs. So because all the muscles are slow in movement, there's reduction in the way the muscles move. So even your facial muscles are affected. So you have a difficulty in smiling. Yeah, your face becomes like a mask. Like a mask. The mask does not move, right? So either it's a sad face or a happy face in the mask. So similarly, for a Parkinson patient, your facial expressions are not so vivid. So you can't, the face looks like mask. Gradually, again, as the stage progresses, you may have difficulty in your swallowing muscles, so you can't swallow well. You have difficulty in doing simple tasks like buttoning. Your motility, your gastrointestinal muscles may also get affected, and so your constipation occurs commonly. You may have trouble sleeping because of the medications, and then a lot of Parkinson's patients also do get into depression. So these are the progressive signs. Yeah. So as the condition progresses and as the disease progresses, these are things that might happen. Okay, so this is a picture of all the signs and symptoms that we talked about. And if we start with a face, this is a masked face. It's a stooped posture. The back is rigid, as in becomes very stiff. The back over becomes very stiff. The trunk, as in the body, becomes very forward. The arms swing. So the arms, when you walk, the arms don't swing very easily. The elbows and the wrist remains bent and flexed. There's a tremor, as we mentioned. The legs may also tremor. The knees and the hips are bent, and the gait or the walking is very shuffling. Okay, and we'll see this in the next video, where we'll see about how a Parkinson patient walks. Okay, so this video will show you how a typical Parkinson patient walks.
This gait is the gait that is a hypokinetic gait. The prototype is Parkinson's or Parkinsonian type of gait. in which the patient will have a posture which will be stooped over, leaning forward, and then will have difficulty as far as initiating gait. When the gait is initiated,
So gait means
there are
walk.
small steps.
It starts with a small
Oftentimes
walk,
there's
small
a
steps.
tremor associated with this.
Yeah, and these are the tremors that might
And as the
happen.
gait progresses, there may be a picking up of speed,
As they
or
start
what's called a
walking, they
fenestrated
become
gait.
faster. It's called
And then in turning, instead of having the normal turning, the patient will turn en bloc, which means they'll turn almost
so they'll just do a
as
pivot turn.
a statue moving around.
Just pivot on one spot, and which is very dangerous.
And then again having difficulty starting in the marche petit pas.
So this is a very typical Parkinson gait that is observed in most patients, and this is again at a later stage, maybe about stage 2 to stage 3, that you can see. Yeah, so how do we get it diagnosed then? Does everyone who walks like that have Parkinson? Does everyone who has tremors have Parkinson? Does everyone who has a stooped posture have Parkinson? No. We definitely have to get it diagnosed, right? So how do we get it diagnosed? We have to see a neurologist. It's a doctor who specializes in the brain, right? So we see a neurologist who will do a thorough physical and neurological examination, ask you lots of questions, and understand your history, understand how, why such a thing, basically does a thorough examination. Of course, you will need some scans, some X-rays, some blood tests to rule out other reasons, other causes, why such symptoms are happening to you. So there'll be some ruling out as well, and then to know, to ensure that, or to confirm the diagnosis. Okay, so now that if Parkinson's is diagnosed, how do we manage it? All right, so there's the medical management. And the most common one is medicines that mimic dopamine, right? So dopamine is not something that can just be injected easily because it doesn't cross the blood-brain barrier easily. So we have to, the medicines are MADOPA, levodopa, or carbidopa. So these are the medications that are most commonly used that mimic dopamine. Of course, no medications or most medications come with side effects. So then there might be some, depending on the dosage, the doctors might give you other medications that reduce the side effects of hallucinations or vomiting. And all medicine, and especially these levodopa medicines, the dopamine medicines, dopaminergic medicines, need to be fine-tuned because each patient's body behaves differently. So for some, you might need to just take it like twice a day. For some, you might need to take it thrice a day. For some, you might need to take it 3 hourly because the dopamine levels are so low in your brain that you need to take it so regularly to enhance the movement of to enhance your movement to be easy so that you're able to move easily. So each patient's medication, each patient's dosage, each patient's reaction to the medication is different. And of course, all this is done by the neurologist. So are there any surgical interventions? Yes, there are surgical interventions for Parkinson's in recent years. And this is something called deep brain stimulation. Again, this is not for everyone. It's not that every Parkinson patient is eligible for deep brain stimulation. And of course, after thorough screening, after thorough examination, after thorough vetting process by the neurologist, then the patient is eligible for deep brain stimulation, and mostly it's given to the younger patients. So what it does is it inserts an electrode in specific areas of the brain and stimulates the brain to transmit signal for movement, right? So this is a special electrode, and it's embedded in under the skin here. Is the stimulator, and then there's a wire that goes through all inside. Of course, it's subcutaneous inside the skin. It goes over here, into the brain. And then over here, there's something that's an electrode that this is the part, this is called the substantia nigra, the basal ganglia, where it gives stimulation to do the movement. Okay, it's not that you have to switch it on every time you want to move. There is a it's already tuned in or activated in such a way that it will be stimulated. This thing also has to be, again, I think I have had patients who have undergone this DBS, deep brain stimulation, and they have to go every 6 months to a neurologist to get it checked, to get it calibrated, to ensure that it's working well as well. Okay, so now comes the physical therapy part. So can we manage Parkinson's non-medically? Yes, you still need the medicines, definitely. But an addition, an adjunct to the medications, you also need exercises, because definitely if you don't manage it, there are certain strategies that physiotherapists can teach the Parkinson's patients to overcome the walking that you saw, and to prevent the falls, to be able to turn well. So these strategies are taught by physios to the Parkinson's patients. So these may include strengthening, balance exercises, gait training, treadmill training, postural control, things like that. Occupational therapy for training your activities of daily living, speech and language therapy for speech, for swallowing. Yoga and Tai Chi and dance therapy have also been proven to help Parkinson's patients as well. So yoga stretches is very helpful. Tai Chi is very helpful for balance, and dance therapy is rhythmic. So the rhythm actually sometimes just activates the muscles to move. So that's something as well that's very, very helpful. Okay, so we're going to see the importance of exercises here, a short clip on that as well.
Keeping active, keeping our bones and joints healthy is very important for the long-term management of Parkinson's. Being physically active doesn't mean putting on a pair of Lycra leggings and going to the gym. It could be simple as making regular trips to your park and enjoying the great outdoors. Thinking about having some time where you're walking, some things where you're going to push yourself and have to walk a little bit faster, doing some strength exercises, and think about speaking to your physio about how you can start doing exercise in your own home before you want to think about being a bit more ambitious. We know that it's beneficial. We know that people respond well to exercise, and they can get improvements in muscle strength. They can get improvements in the individual components of walking, such as step length, step stride, step speed, and overall walking distance. And we also know that they can improve their physical fitness as well as that. And to top it all off, we all know that that culminates in an improved feeling of well-being and an improved quality of life. And I think that is really, really important, that we're looking at research that also thinks about how could I change somebody's life from somebody who's just sitting in the front room every morning to try making somebody who can go out, feel confident and engage in society, because they've got a lot to contribute. Do it. Just do it. Get started and think about making regular exercise. So it's not just once a week, it's thinking about little and often throughout your daily life.
So yeah, so of course the lady was talking about how exercise is essential. It's an integral part of management of Parkinson's, and if you would speak to any neurologist, they would tell you yes, you have to see a physio, because there's lots of things that we can do to help with management of Parkinson's, especially in the early stages. Of course, alternative therapies, as you saw in the video, there was dance, there was rhythm, there was mat work. So all these other components of exercises that can help with the Parkinson's management as well. Okay, let's talk about certain aids and appliances to improve function. So of course we try to keep the patient as independent as possible, to be able to move on his own as much as possible, but at there might be a stage where he or she might need some aids to walk about, to move about, to still maintain an independence. And these are some of the aids that are available. So this is the rollator. And this is available at Golden Concepts, and I actually have had a few patients who use this, and it's pretty good. The reason being the back part does not have wheels. Only the front part has wheels, and the back part actually has a good rubber tip that actually prevents it from sliding forwards easily. So it's quite a good, contrary to popular belief, one might think that because it has wheels, it can just sort of swoosh and fall forward. No, it actually is quite good. It gives a good rhythm and cadence to the walking. So this is, and it's also very easy to fold and carry and light. So this is nice. This is a normal walker or a walking frame, which you got to lift up and walk. This is another one that's available also easily in Singapore, with a shopping basket and trolley with a bicycle brake kind of thing. Again, this one person has to be very cognitively intact and cognitively with us to understand that he or she has to break it so that when if and when to go on slopes and all. These are the other common ones, like a 4-point quad stick, a single point stick. This is a built-up handle spoon, and I think Golden Concepts has this as well. This is again good for feeding, because for Parkinson's patients, if at all you cannot hold a small thing, you cannot hold a small spoon because it's sort of your hands are not steady or not strong. Something like a built-up handle spoon is easy to hold, and then able to maintain the independence of feeding for the patient. Okay, all right. This is another video of a rollator. I think Golden Concepts has this rolls motion video, and I this equipment, which I thought was very, very interesting, because it has certain cues that is required for a Parkinson's patient, especially when you do gait training as physios. When you do gait training, sometimes some cues or some hints. So you teach them a rhythm, 1, 2, 1, 2, or you teach them left, right, or sometimes you give them certain just audio cues to say tick, 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 and then just with that rhythm, it helps them to move better. Alternatively, sometimes if there's strips on the floor, then if they see a strip, they can cross the strip easily. Again, how this thing happens because of the dopamine thing is a lot of neurological science behind it, but these are certain strategies that can be taught to a patient to be able to move better. So this rollator has incorporated the visual cues, which is like a laser beam. It also can have some audio cues, and also has some vibratory cues. So I thought it was an interesting rollator to use for Parkinson's. So you can have a look at the video. It also has the seat and a basket. These are the different functions. This is the laser beam. You can cross over the laser beam as well. This is the audio. This is a vibration. And this is the audio. And you can make it faster or slower depending on what works for you. See, you can make it faster. So it depends again, as the physio will tell you what works best for you. And it's, so this is quite a high-tech rollator. So for a young onset Parkinson's, somebody who has has a severe disability in his younger, when he's still young, and still, of course, we want to keep patients as safe in the community as possible. This is something that's a good option as well. Okay, so now, can we prevent it? How to prevent Parkinson? If we knew it, of course, nobody would be having Parkinson's now, right? Just like COVID, right? Can we prevent it? Since we don't know how one gets it, it's difficult to know how to prevent it, right? So as I said, it's idiopathic. We still difficult to know how to prevent it. But of course, there's lots and lots and lots of research that is done to say you can eat this or don't do this, or get more less exposure to this and things like that. Some research say that coffee drinkers are at a lower risk. Okay, but when I say this, it does not mean that you just go on drinking coffee. Of course, we have to drink it as its limit, because of course, as we know, coffee has other side effects as well. So 2 cups a day is good enough. Healthy lifestyle, like good nutrition and regular exercise, is good for anything and everything else for the body. Yeah, so it helps with range of motion, good sleep, good digestion, and improves blood circulation. So a healthy lifestyle is good for the overall well-being of a person. Yeah, and that comes to the end of my session. Thank you.
Thank you so much, Tasneem. I think that was a great sharing, and also a great overview of what Parkinson's is. We will perhaps open the floor for some questions. If you have any questions, yeah. If you have any of you all have any questions, you can either just unmute your mic and then you can just ask the question, or if you're feeling shy, you can just type the question in the chat, or we'll also be sharing Tasneem's contact right now, so you can also just get in touch with her directly. Yeah, I have a question, Tasneem.
Okay.
Yeah, just to get the ball rolling, I was just thinking, if somebody has already been diagnosed with early stage Parkinson's, how would you as a physiotherapist, what would be your first steps that you take to help an individual like that? And also, if what happens if the person is quite reluctant to have any treatment, how would you go about doing it?
So if he's been diagnosed with young onset Parkinson, that means he's seen a neurologist, he's already confirmed Parkinson, and if he's come to see a physio, that means he's, he has certain reasons to come to see a physio. Not every young onset Parkinson is referred to a physio, because some of them, the symptoms may be pretty mild, so they may not need to come and see a physio at that very early stage. Now, if he has come to see a physio, there might be certain things that most young onset Parkinson's that I see.
I think we may have lost Tasneem. Tasneem, welcome back.
Sorry, something happened and my Zoom hung, I think.
It's okay. I managed to talk for a while.
Right.
So Tasneem, we actually have we're also in the midst of a question about somebody diagnosed with early onset of Parkinson's, and trying to seek help from physio. Somebody
who's diagnosed with early onset Parkinson's and seeks help.
Yes, seeking help from physio. What would be your first steps that you usually do to work with an individual like that?
Honestly, we have to assess the patient. What are the deficits? What are the impairments? If only when we assess and find out the impairments, then we can work on what needs to be done. So if you can tell me the complaints, I can understand the complaints, but I will still have to do an assessment to find out why these complaints are happening, and then I can teach the strategies that need to be done in order to to go on and progress. But I would still, it's good that they want to see a physio. That's very good, and continue with exercises, whatever exercises that you're doing, activity and exercises, walking, cycling. These are very important ones for a Parkinson's patient. Yeah.
Okay, just to add on to that, Tasneem, what about if the person is reluctant to seek help? Have you ever encountered cases like that before?
Yeah, so that's when we have to rope in the family members, because help with the understanding as the disease progresses, the family members are the ones that get stressed the most, because Parkinson's is something that the patient may get more dependent, and the family member then has to be taking care of the person gradually, right? So the caregiver is the one that gets more stress. So we have to then rope in the family members to encourage the patient, the person himself with Parkinson's himself, to be able to, to understand why this thing happens and what is the importance of exercises if the person himself is reluctant. Yeah, so education is what is important over here.
Yeah, and I think definitely we have a couple of questions actually in our chat.
Okay, let me have a look.
So, yeah.
If a brain scan shows that one side of the brain has reduced brain matter, which is diagnosed as small vessel disease, does that mean it is also Parkinson's disease? No, small vessel disease can lead to Parkinson's, but it does not mean that small vessel disease is Parkinson's. So no, it can lead, small vessel disease will have other symptoms as well, but small vessel disease can lead to Parkinson's. How to improve Parkinson patient on swallowing food? Swallowing food, okay, so if he has issues with swallowing, then I'm sure that you may have seen a speech therapist. If you have not, then it's better to see a speech and swallowing therapist, because they are the person, they are the therapists or the professionals who will be able to tell you in terms of what kind of consistency of food to eat. So do you need a blended diet? Do you need soft food? Do you need to have honey nectar consistency? So the speech and language therapist is the one that will be able to guide you and give you more information in terms of how to improve the swallowing. But again, very important in terms of posture is important, because again, a Parkinson patient, because he's stooped forward like that, the head is forward, and that already it prevents the swallowing. So, just improving your neck extension, helping putting up the body straight, pushing your body against the wall, keeping that erect posture will already help in the swallowing process. But more intricate exercises would be given by the speech and language therapist. The other resource that for Singapore, we also have the Parkinson's Society. I do not know whether everyone has heard about it, but Parkinson's Society is something that's also does great work on Parkinson's, that also carries on Parkinson's classes. It has the holistic classes for patients who can go in for sessions, 1 hour sessions. Of course, now because of COVID, the group size is smaller. But previously, I used to be running the classes there, and so we have a bigger group. They have good exercise machines there. They have a Tai Chi specialist. They have different things that they have yoga, they have Tai Chi, they have physio. So there are different things that encompasses and the whole rehab of the Parkinson patient as well. Okay, there's another question.
For the Parkinson's Society, do we just get in touch with them, or we need a referral or something?
You can actually call them, but you definitely need a referral from your neurologist. So any neurologist is fine. Need not be so any doctor. I think most probably a neurologist. You need to call, and I'm sure if you diagnose it, so you have to have a confirmed diagnosis of Parkinson's. That's the first thing. So if you have a confirmed diagnosis of Parkinson's, that means you have seen your neurologist, and the neurologist will be able to refer you to the Parkinson's Society.
Okay.
Okay, so the question here is on low blood pressure, BP taken before Madopa. Oh, that's quite high. 62.5 milligram is this much. After Madopa, 1 hour or 2 later, BP drops to 85. First time the patient is taking Madopa, should she continue taking? Because her next appointment is 1 later. Yes, Madopa is known to drop blood pressure, and this is a very significant drop. Why is the Madopa dosage so high? So is actually very, very high. And if it's the first time the patient is taking Madopa, then you might want to immediately call the nurse, the clinic that you went to, and tell them about this, and they will have to titrate the dose, because this is very high. I will not, this, yeah, 1/4 tablet, that's fine, but it's still a high dose. You might want to call the clinic and titrate the dose. So you might want to, you know, take the dose in two sessions or something like that. Again, if it's the first time the patient is taking Madopa and the BP drops, is again very common, something that happens to a lot of patients. So if the BP has dropped, is it in sitting or lying? This is what you need to know. If it has happened, the 123/80 is in lying and 85/53 is also in lying, then it's a very significant drop. If it's 122/80 is in sitting, or rather, sorry, 122/80 is in lying and 85/53 is in sitting, then you might not be very, both are sitting position according to the person who is questioned it. So both are sitting, then is a big drop. So if it's the first time taking it, it's quite common for this thing to happen. You might want to monitor for at least 3 or 4 days and see how significant is it, because your body has to get used to the Madopa dosage. So I hope that answers your question, because your body has to get used to the Madopa dosage that is happening, which is suddenly, if you're taking Madopa, which is the first time you're taking after a diagnosis, BP might drop, but it'll tend to stabilize after a while. Very important, if you see a drop in BP, you do not want to stand up because you can fall. You might want to just sit down and keep your feet up, elevated, so that the BP stabilizes. And then you will, after you stand, make sure there's somebody with you when you start walking, because you might, again, as you stand, the BP might drop again. So when the BP drops in standing, sitting, if it's so low, in standing, it might drop further. So you might want to make sure that there's somebody with you all the time, and stabilize your BP first. Yeah. If you're really still very concerned, you might want to call the clinic and tell them about the BP readings. It's very good that you're taking the BP readings. That's very, very proactive of you. Okay, thanks for early advice. Does mean that small vessel disease and Parkinson's disease will have clear different brain scan results? May or may not, because Parkinson's disease is something that can't be diagnosed on a CT scan. It will be more on MRI, and it has to again, just the MRI will not confirm that it's Parkinson's, because it has to coincide or correlate with the symptoms. Okay, so if you have the signs and symptoms and also the showing on the MRI, then the doctor will be able to confirm that it's Parkinson's. So there will be lots of, as I said, there's a whole battery of tests that needs to be done in order to confirm there's a Parkinson's disease. It's not something that's very easily diagnosed. So yeah, I hope that answered your question.
Great. I think it's great. We managed to have time for a couple of questions. So if you have any other questions, just feel free to get in touch with Tasneem directly. That's her WhatsApp number. And she's quite busy, but I think all of us are kind of just trying to cope with the recent updates, the COVID-19 situation and all that. So hopefully everybody do stay safe. In a couple of weeks' time, on the 29th of May, we'll be having our next event. So do look out for that and do join us. It'll be on the lasting power of attorney. So it should be quite important for those of you if you haven't done it.